Hello everybody and welcome to our virtual coffee with an OSCE educator. My name is Sarah Grant. I'm the director of My Healthcare Recruit and owner of OSCE Accelerator. And we get lots of questions on our social media about the OSCE test and often the evaluation station. So we have got the lovely Beth Carter with us today. Hi Beth. And Beth is a lead OSCE educator. She's been teaching at an NHS trust for the last 5 years. She is a wealth of information when it comes to OSCE. And so we thought that we'd use this virtual coffee session to have a little bit of a deep dive into the evaluation station and ask all of the questions that we know that you've been asking. So, Beth, without further ado, let's dive in. What can an international nurse expect from the evaluation station? What will they be presented with?
Okay, so it will be, again, the same patient that you're following through with the whole API, assessment, planning and implementation. As with other stations, you're going to get a document. This is going to be called Evaluating Care. On the front of that, it's going to give you, as always, a little update about your patient. It's going to include the most recent vital signs, and it's going to say the reason for the handover or referral. So it can be handover to the next shift, which is quite easy. It also can be referral to doctor or to another team. They have laid it out by the SBAR tool, which I don't know if you've heard of, but if not, I would recommend looking that up. So it stands for Situation, Background, Assessment and Recommendation. So you have to make notes about what you're going to do for your handover, and then you need to give the handover to the examiner. You will get all your paperwork with you from the other stations.
And key question, how long will learners have?
So it's quite fast, it's 8 minutes. So that includes making your notes. So try and prioritize your time. Don't spend too long writing your notes. You can write in shorthand, you can write abbreviations, that's fine. They don't mark those. So
they don't mark the notes, they only mark the handover, the SBAR handover.
Yeah, so give the majority of the time to your handover. Obviously, give yourself some time to prepare so you know what you're doing.
Wonderful. So let's look into each of those SBAR segments in a little bit more detail. The situation segment, what information should be included in that segment?
Okay, so the structure for the exam is a bit different to the standard SBAR structure you might see. So please don't go ahead and give your handover like you would normally. Because it's completely different in the exam. So your normal handover that we would give or receive, for example, on the ward, that's not going to pass, okay? So if you look at the marking criteria, it does give a clear guidelines of what you need to do. So if we go through that, starting with the situation, you need to introduce yourself and the clinical setting. You need to introduce the patient, give their details, including date of birth and hospital number, state the reason for handover. So if you're not sure of that, it will be on the front of your chart, and it might be like a referral to the mental health team, for example, something a bit different.
Got you. So that situation then, what about background? What information goes into the background part of the handover?
Okay. So that should be the date of your admission or visit, diagnosis, past medical history, any medications or social history, and details of the current events, just an update and findings that you have in the assessment. So anything you've noted in the assessment that is abnormal with the patient.
Got you. And then you go into the assessment part of the SBAR. How is that different? What information would you include in that part?
Okay, so again, I would just use the marking criteria, which I'm going to go through with you now. So you need to say the patient's most recent observations. So they will be on the front page of that evaluation chart. So you can just read them out. Obviously, know anything that's abnormal there. You will need to ask the other member of staff to escalate that. Any results from assessments or changes that have occurred, the patient's nursing needs, So you will have written about a couple of these in your care plans, but also you can write about other things. Because we only have 2 care plans, there's also sometimes a lot more things we would like to mention, so we can mention those. Remember, think of the patient as a whole. Interventions that have been conducted, so they might have gone to theatre, they might have had an x-ray, these kind of things will be on those little updates. Mention any medications you've given, any areas of concern.
Wonderful. And then finally, the SBAR handover ends on the recommendation section. What goes into that area?
So this is your recommendation to the other staff member. So state what is required of them. If it's just a handover to the next shift, you can just say to continue the patient's care, that's fine.
Yeah.
If it's a referral to another team, you need to say, oh, can you review John because of his weight loss, or whatever the referral's for example. Propose a course of action, as we've mentioned, and also you can mention if there's any health education needed for the patient.
Got you. What happens if you perhaps wanted to make a referral but hadn't gained their consent at an earlier station? What would you do in that situation?
So you could put that as one of your recommendations to the person you're handing over with. They can discuss that with the patient and then conduct the referral themselves.
Got you. And then I guess to summarise, any top tips for this station, any areas that you would suggest candidates focus on to try and get the higher marks and avoid some of those silly mistakes?
Okay. As always, practice with your timing because it's quite short. Don't use any abbreviations like MBM, nil by mouth. They don't like these. If you're short on time, try and prioritise. Remember to double check the date and time specifically that you've been allocated to hand over the patient. Also, if you have to do the handover like to the doctor, for example, you just use the marking criteria and follow it in that way. I know it's not how we would communicate with the doctor, and we're telling the doctor things that aren't relevant to their job, but that is what they want you to do to pass the exam.
So just that fully comprehensive SBAR handover. Wonderful. Well, that was a super helpful insight into the evaluation station. Thank you so much for breaking that down for us and helping us understand what goes into each of those segments. I hope that will be super helpful for our learners. But thank you for joining us today, Beth, and we look forward to speaking with you again soon.
Thank you, and good luck with your exams.
Bye now.
Bye.